So we're glad to have Smoothie is coming to talk with us. We're going to ask her a few questions, but I think we should give her a great clap for having stood up. Thank you. So we have a few questions for Smoothie. Thank you so much for agreeing to talk with us. She'll tell us a little bit about herself, but the first question is, how long have you been on treatment?
I've been taking treatment since 2020. I think it's 2 years now. Yeah.
2 years. So where do you live right now?
I live in Durban.
In Durban,
Yeah.
Durban, South Africa. So thank you for coming all this way.
Thank you.
Can you let us know what your experience has been when you're taking your treatment? How has it been? Any problems? Any challenges when you're taking your treatment?
Nah, I didn't have any challenges or something or side effects. Nah, everything was perfect.
Wow, aren't you lucky?
Yeah.
So, but we know that many of your colleagues, your friends, they have challenges and they have problems taking their medication. What advice would you give them to help them take their medicine better so that they don't miss their doses?
I think, first of all, should I say you or them?
You should say you.
Okay. You.
Them. Whatever, what they prefer.
Okay, first of all, you as doctors, you have, or scientists, you have to create a pills and don't give you many pills, like 4 bottles at a time. You must give one bottle per person. Yeah. Do you have?
Okay.
No.
I think we're hearing that 1 bottle at a time.
Yes.
Don't give me 4 bottles at a time.
Yeah.
So you would rather come back and collect the second bottle rather than being given all the bottles?
Yeah.
Okay.
Yeah, I prefer that.
Okay.
Taking many bottles make noise in a taxi.
Oh, yeah. Okay. I think we all hear it making noise in the bag. It's not quite music.
And
Okay.
another thing, taking many pills as a young person, it's very bad because sometimes you forget to take the other one and you take one. Yeah, so that's why I prefer. You must create. Maybe you must. Yeah.
Okay, combine. Okay.
Yeah.
So right now we have a fixed dose combination of three drugs in 1 pill.
Yeah.
So that is good.
Yes.
Okay, but still, with 3 drugs in one and 1 pill once a day, there's some of the youth or some of us, they don't take the medicine as we should. So what advice would you give you or them?
I think, first of all, we must unite as young people and talk about problems or consequences we're facing.
Yes, good, very good.
And talk about problems and figure out how can we, as young people, take pills or what.
Okay, so we need to meet, we need to talk and see what the problems are among ourselves, among the young people.
Yes.
Yes, thank you so much. What would you say for a clinic or treatment program? What would help the youth come to the clinic, feel more comfortable to come to the clinic for treatment? What things will make it better for them?
Okay, for them, because
For you.
my clinic is perfect.
Oh, really?
Yeah,
Wow, aren't you?
public clinics. In public clinics, young people get attitude from nurses. They talk to them Okay, they shall, sorry, they talk to them, they shut them in front of others. They
Yes.
don't care if they tell you your status in front of people or what. So yeah, and they must create a private place where HIV people will get there. They must not mix us because they can see our faults.
Yes.
Yeah.
Okay, very important point. A separate space, even if it's a joint clinic that is private, so that they can have privacy maintained. We also ensure that when you're talking, even if it's at the end of the day and the nurse or whoever is tired, we need to speak nicely.
And another thing, they have to listen to young people why they did not attend in that state or what they must not know. Yeah.
Okay. I think your friends are clapping because they're saying it seems, it seems when they miss visits, there's such a harsh reality instead of trying to understand why they've missed. Not so? Yes. Okay. Would also, before, in terms of the future of treatment, I know one pill once a day is great. What would you think is the best treatment you would like if you were planning for the future? And they said your wish list, what kind of treatment would you like to have?
I prefer injection.
Okay.
Because if I go to a clinic and come back, I'll be empty-handed. No one will know if I'm HIV positive or.
Thank you for that. The injections have become very popular. You don't mind the pain? We can tolerate the pain. It's not every day.
No, I don't.
Okay. So I want to thank, can we clap for Smoothie?